primary health care seeks to extend the first level of the health system from sick care to the development of health. It seeks to protect and promote the health in communities and to address the health of communities and to address individual and population health problems at an early stage. Moves beyond the acute health focus that hospitals, it does move beyond the acute health focus that hospitals and their staff often have. And it enables the nurse to consider the needs of the whole person, their family and the community in which they live. Primary health builds and preserves health and well-being of the individual, their family and the community, and contributes to building a strong, healthy and self-reliant community. In these communities, nurses are also a scarce resource, so we need to think about how to develop the people we have to respond to the healthcare need at any time, any day of the week. And I think I'll finish on saying I see this particular project and this service as an absolute exemplar in being able to do that, to engage the community and the organisations collaboratively to define a service that really does respond to the needs. And I don't think it will stop here. I think the service will change over time as your needs change, but you sort of know how to do that. You can actually provide the evidence, come up with alternative services and present it, advocate on behalf of your community. So I really do congratulate you on an amazing effort. And it is an exemplar I will be putting in on some policy work that I'm undertaking right now, so you'll probably see it written up one way or another. I hope someone else is writing it up too. But thank you again for having me here and congratulations.
Well, thanks very much. He's going too fast. You'll clear the bed for him. Thanks very much for that. And also, what we've been talking about, congratulations. I think it's congratulations on the beginning. We see this as the beginning of a much extended service, and certainly the steering committee, which now becomes the advisory committee, sees very much an ongoing role in the whole of the service, not only in evaluating it, but in looking at how it can be extended and linked perhaps to an even wider community is what we're doing. And it's with great pleasure that I call on Dr. Bill Sykes, who's well known to, I think, a lot of people here, to officially open the year-round health service on Mount Buller.
Thanks, Ron, Judy, Janine and Elise and all of you. It's clearly a community effort. I think I'd just like to make it very brief. I'd like to endorse the remarks of Judy and Elise and officially declare the Mount Buller all year round Community Health Centre open. How's that? We've got Parliament this week. I've got to warm up, got to get a bit of aggro. No, this doesn't fit in because the first thing I'm going to do, warming up for Parliament, is to acknowledge the effort of the state government in their contribution of the $50,000 a year for the first couple of years. That is a good contribution by the state government, and I should say that Daniel Andrews, the Minister for Health, is a good minister to work with. He does have an empathy with country Victoria, and he played a role in making this happen, so that's very good. I'd also like to acknowledge Megan's efforts. Obviously Elise has already sung your praises and it's taken it all off my script, so I won't repeat, but it's obviously a gem, a great one to have in the start-up phase, so thank you very much, Megan. I would like to acknowledge Kathy, whose persistence, resilience, just dogged determination is a big part of why this has all come about. And then that links to what both Elise and Judy and Ron have clearly indicated. This is a team effort. We talk about community capacity building, we talk about all that. All I would like to say is this is a bloody good team effort, and it reflects the strength of this community, the Mount Buller community, and also the associated Mansfield community. I get round the traps a bit, and I'd have to say that this neck of the woods is noted for being a can-do community. So well done to you all for that. The other key player, and this has been the board and the support that the Resort Management Board has given Judy, given to them, so thank you, Judy. And the other key thing is that this is a step down, a big step down a long road to have Mount Buller going to a year-round resort, and 2 days a week, a good start, but we want it up to what, 5, 7, whatever. 24/7, is that what that is?
Sure, no problem.
Actually, I think if the silly buggers fall over in the night time, they should.
You're on their own.
I think the message is stay where you are, isn't it? Don't move, and I'll come and get you in the morning. Don't call me, I'll call you. All those lines. So, no, it is really very good. So thank you all very much, and I would now like to. Oh, I'm going to do that before I declare it open. Okay, I'll do that.
Do this first.
Yeah, now I've got to get serious here. No more frivolous stuff.
Well, this is really serious. You could straighten your back here.
This is drought resistant, isn't it? Yes. Okay, Kathy Chivers, would you please come forward? I'm going to read this because some work's gone in this. Kathy is also deserving of a special thanks and congratulations in her role as Community Liaison Officer, where she was pivotal to the success of the entire project. She did a Who done that? She did a remarkable job of research, bringing the community together, drawing up the proposal, following it through to acceptance, gaining of funding and implementation. Much of it was in her own time, and the success owed much to her pleasant manner, persistence, attention to detail and empathy. That's a pretty good wrap, so well done, Kathy. You just hand over.
I don't think I better go with.
Wow, that's amazing. Thank you so much. You shouldn't have done that at all. It's been a pleasure to work with you all, so thank you.
Okay, and at this stage, I'd now like to, this time, officially declare, let me get the wording right, big writing. I'd like to officially declare the Mount Buller and Mount Sterling year-round health service officially open. Long may it live with a minimum amount of customers.
Is eat, drink and be merry, and I've been told no one is allowed to leave until the food is all gone. Thank you.
You'll be here all night.
Oh, sorry, there is one, sorry.
Yeah, thank you. Ron, on behalf of Monash University, we would like to present you all with a certificate of collaboration, which identifies the key partners that were involved in this collaborative project, to acknowledge the work that you've done and achieved, and again, it wouldn't have been successful without your cooperation. And we thank everybody. We have to look all around the room because pretty well everybody's had an involvement. You've identified one of the key people. I can only but encourage you now to use the skills that Kathy has developed in learning along the way with this project. We wish you all the best in the future. We will be talking with you about evaluation down the track, and hopefully the service will be developed further and we'll help another community with this project. So thank you and congratulations.
Oh, thank you. No one else wants to say?
Last word.
Well, help yourself,